Hey, nice to have you with us on a Wednesday. Wednesday, it's Mansfield today, and that's time for Things Medical. Now, usually we have Dr. Vicky Skitter, our resident GP, sitting next to me, but she's away this week, and so we thought we'd bring in somebody just as pretty. And I'm funny here. Yeah, geez, you're going to do that.
Thanks for the compliment, Jeremy.
It's a pleasure. Ladies and gentlemen, let me introduce you to Quito Esteves, who is, you're a property developer of sorts, but in a very specialized area. It's psych facilities. What is a psych facility?
First of all, thanks very much for having me on the show, Jeremy. I really appreciate it. In these times, we need to put psych facilities out there more so than usual because of the pandemic and what the world economy is going through. But to answer your question, a psych facility is a facility where people are put in for a 7, 14 or 21-day program, depending on the severity of their mental health state. And the psych facilities that you get in South Africa are voluntary and institutional, which is when you become a state patient.
Okay.
And those are very specific facilities that are owned by the state, such as Falkenberg and Sterkfontein.
Okay, what difference, apart from the state and the let's call them non-state facilities, private. What sort of different psych facilities are there?
Okay, so we get a psych facility which is an inpatient facility, which has got wards and group rooms, doctors' rooms, sessional rooms for the patients to be treated in. And the wards normally have up to about 4 people in it. You get private wards, and it's normal beds, it's not clinical beds, but it has to comply with a document which is called the R158, which is the guidelines for the developing of psych facilities. Then you get outpatient facilities, which is a facility that's got a lot of group rooms, doctors' consulting rooms, where you go in for therapy from 8 o'clock in the morning till 5 o'clock in the afternoon, and you go home. And then you get the halfway houses, which is for people recovering from some sort of addiction. They're not really ready to be integrated into society, but they're not too bad to be incarcerated, so to speak. I would imagine you would need a license to operate these sort of facilities. Oh yes, most definitely.
Yeah.
You need a license from the Department of Health, and to get that license you have to provide need and a needs analysis, and one has to go through a series of feasibility studies to prove the need in a certain area. Obviously highly densified areas have got a lot more people living in them, and those people will obviously be more prone to having mental illnesses. That license is not an easy thing to get. You make an application to the Department of Health. As I say, you have to prove the need for it, and then you have to submit the documentation, and it can take up to 2 years to get a license, which I think is a pity, because at the moment this pandemic has created huge pressure on mental health. It really has.
Okay, I want to get to that a bit later. I would imagine as well, if we're talking about the sort of legal aspect of it, that you would have to get permission from local authorities as well.
Most definitely, yeah. The site would need to be zoned for institution, which allows you to do a clinic, a hospital, a mini hospital, subacute. You'd have to get town planning approvals. The Department of Health would have to come and inspect the facility. If the facility is not built yet, they'd have to approve the plans. Fortunately, we work with a professional team. In fact, the oldest architectural practice in the country, KMH, and they've got a hospital portfolio down in Cape Town and in Johannesburg of fantastic they really are good.
Okay. Do you have to be a psychiatrist or a psychologist to own a facility like this?
No, you don't. You can be an entrepreneur to own a facility like that. You just make sure that you've got the right clinical multidisciplinary team on board, which includes doctors, psychiatrists, occupational therapists, physiotherapists, all those types of people to augment the MDT, the medical multidisciplinary team.
Just out of interest, how many of these sort of facilities have you been responsible for in South Africa?
I've been responsible for between day clinics and mental health facilities about 15 in about as many years. So basically one a year.
Yeah.
We could do a lot more.
I would imagine, and this is where I want to come back to a point you raised, because of the pandemic, there are all sorts of things that have hit people from a mental point of view. Do we have enough facilities now, and are there enough facilities in the pipeline going forward to cope with what's going to happen in society? Because I would imagine that you've got people who are severely depressed. They've lost their jobs. They've lost family members. Do we have enough facilities now? And going forward, are there plans to create them?
I don't think, quite honestly, we have enough facilities, Jeremy. We always talk amongst ourselves, and when something happens which is sort of a catastrophic event in your life, you lose your job, you get diagnosed with cancer, you get diagnosed with diabetes, you get diagnosed with HIV/AIDS, there will always be a psychological intervention. And if not treated, you may end up in one of these facilities. So my answer to that is there aren't enough at the moment. Schools at the moment, especially in our area that we live in Gauteng, there's a lot of private schools, and these kids are under huge amount of pressure to perform academically, to perform as a person that is compared to fake people out in social media, for argument's sake. So a lot of name shaming takes place, a lot of bullying, cyberbullying takes place, and those kids are under severe pressure to cope with these things. If they're not caught early, it can lead to a lot more problems. I mean, you do get people that are schizophrenic and then they start drinking. So that's a dual diagnosis. So you have to deal with that, and you have to deal with their drinking problem. In the pipeline, we have certainly got a number of facilities that we've eyed out, existing and new facilities. We've got a couple of applications in with the Department of Health, and we're hoping that those come through. Because whilst we stimulating the economy in the sense that we creating jobs, we also very importantly are healing people.
Kita, it's been fascinating, and I think we need to maybe get somebody in and follow up on that whole issue of school kids and cyberbullying and the pressure that children are under. Maybe it's something we can get a psychologist in to look at. But Kita Estevez from Estevez and Associates, thank you very much for joining us on the Medical Show right here on Mansfield Today. Until tomorrow, bye-bye.